15 signs of dementia that few people know. Have you ever noticed someone forgetting where they put their keys more often than usual? Or perhaps a loved one who was once good with numbers now struggles to pay bills. Could these behaviors be more than just simple distractions or aging? Dementia, a condition affecting memory and other cognitive functions, often begins with subtle signs that may go unnoticed. In this video, you'll discover 15 signs of dementia that few people know about. Why is it so important to recognize these signs early? And are there ways to prevent or delay this condition? By understanding these symptoms, you can seek medical help and implement care strategies that make a difference. Stay tuned until the end, because sign number 14 is the most dangerous, and few people know about it. Important! We have listed all the references used to create this video in the description for you to access whenever you want. Let's get started. What causes dementia? Dementia is caused by damage to brain cells, which affects communication between them. This can occur due to various diseases, with Alzheimer's disease being the most common. Other causes include strokes, head trauma, and neurodegenerative diseases such as Lewy body dementia and frontotemporal dementia. Risk factors include advanced age, family history, and health conditions like hypertension, diabetes, and high cholesterol. While some forms of dementia are irreversible, understanding their causes can help in the prevention and management of symptoms. Dementia. Is there any hope for reversal?
Now to put this in perspective, mental decline happens progressively, and sometimes quickly, sometimes slowly, but never gets better according to our traditional medical thinking. But just like we thought heart disease and plaque in the heart couldn't be reversed before we thought that, now we have proof that does happen. And I believe that dementia can be reversed if caught early enough by attending to all the factors that affect brain function: diet, exercise, stress, nutritional deficiencies, toxins, hormonal imbalances, inflammation, and more.
Although there is no cure for most types of dementia, some treatments can help manage symptoms and improve quality of life. Medications can relieve symptoms such as memory loss and behavioral problems, while cognitive and occupational therapies can help maintain functional skills for longer. In some cases, dementia caused by vitamin deficiencies or underlying health issues can be treated or even reversed. However, early diagnosis and appropriate treatment are essential to optimize outcomes and slow the progression of the disease. 15 signs of dementia that few people know. 1. Memory problems. When does forgetfulness become a warning sign? Memory problems are often the first signs of dementia and can manifest in various ways. Forgetting newly learned information, such as important dates or recent events, is a common symptom. Patients may start relying on notes or electronic devices to remember things they previously handled easily. Another sign is repeatedly asking the same questions, even after receiving answers. These memory lapses go beyond occasional forgetfulness and can interfere with daily life, making it difficult to perform tasks that require concentration and memory. Additionally, forgetting appointments or frequently losing objects may occur. These symptoms indicate that the brain is struggling to process and retain new information. Early identification of these problems is crucial, as it can lead to faster diagnosis and treatment. Strategies such as maintaining a structured routine, using visual reminders, and engaging in activities that stimulate memory can help manage these symptoms and improve the patient's quality of life. 2. Planning and problem solving. How dementia changes everything. Difficulties in planning or solving problems are common indicators of dementia, affecting the ability to perform tasks that were once simple. This may include problems dealing with numbers, such as paying bills or keeping financial records. Affected individuals may find it challenging to follow a plan or recipe, and may easily get lost in the sequential steps of a task. This difficulty extends to everyday situations, such as solving unexpected problems or making quick decisions. For example, a person may become confused when using a household appliance or deciding what to do in unexpected situations. This loss of problem-solving skills can lead to errors that impact daily life, such as neglecting home maintenance or failing to make sound financial decisions. Additionally, the inability to plan can result in frustrations and conflicts with family members or caregivers who may notice a change in the ability to handle routine tasks. Introducing support systems, such as checklists and financial assistance, may be necessary to help the person cope with these difficulties. 3. Daily tasks. What happens when they become challenging? Difficulty performing familiar tasks is a symptom of dementia that manifests when a person has trouble executing daily activities that were once done with ease. This may include cooking, cleaning, or even dressing. For example, a person may have difficulty remembering the steps to prepare a meal or forget how to use common kitchen utensils. Additionally, there may be difficulties in remembering the correct sequence of getting dressed, resulting in inappropriate clothing combinations. The loss of ability to perform these tasks can be frustrating and discouraging, leading to feelings of inadequacy or dependence. For family members and caregivers, these signs can be clear indicators that the individual is experiencing cognitive decline. Creating structured routines and introducing visual reminders, such as labels and task lists, can help the person stay oriented and independent for longer. In more advanced cases, additional support may be needed to ensure that daily activities are performed safely and efficiently. 4. Spatial and temporal confusion. Can you recognize this sign of dementia? Confusion with time and space is a characteristic symptom of dementia, where individuals may get lost in familiar places or forget the reason for being in a particular location. This disorientation can manifest in various ways, such as not knowing what day of the week or season it is, or confusing the passage of time, believing that past events occurred recently. In more severe cases, the person may become lost even in their own home or neighborhood, forgetting how to return home or how to reach familiar destinations. This type of disorientation is concerning as it can lead to dangerous situations, such as leaving home and being unable to return or getting lost in public places. Temporal confusion can also manifest in situations like waking up in the middle of the night and starting to prepare for the day, believing it is morning. Measures such as creating familiar and safe environments, using large, visible calendars and clocks, and, in more advanced cases, considering additional safety measures such as location monitoring can help manage these symptoms. 5. What can dementia do to your vision and comprehension? Visual and comprehension problems are symptoms that may indicate the presence of dementia, affecting the ability to interpret visual and spatial information. This is not limited to visual acuity, but includes difficulty recognizing faces, interpreting colors, contrasts, and assessing distance or depth, which can lead to tripping or falling. For example, the person may have difficulty judging the distance of steps or may not perceive the depth of a glass when filling it. Additionally, there may be problems understanding visual and symbolic signs, such as traffic signs or maps, complicating activities like driving or navigating public places. This symptom is particularly prevalent in forms of dementia, such as Alzheimer's disease and Lewy body dementia. These problems can be mistaken for common visual difficulties in the elderly, but in dementia, they are persistent and progressive. Adapting the home environment with appropriate lighting, contrasting colors, and non-slip surfaces can help minimize the risks associated with these visual problems. It is important to consult a specialist to differentiate between age-related visual problems and symptoms of dementia. 6. Difficulty with words, a surprising sign of cognitive decline. Problems with words, known as aphasia, are frequent symptoms in patients with dementia. These difficulties manifest in speech and writing, where the individual may struggle to find the right words, resulting in fragmented or incoherent communication. For example, the person may substitute familiar words with less appropriate ones, or create nonsensical words. Additionally, there may be excessive repetition of words or phrases or difficulty following or participating in a conversation. In writing, symptoms may include incorrect spelling, incomplete or incoherent sentences, and difficulties in organizing thoughts logically. These communication problems can be frustrating for both the patient and those around them, leading to misunderstandings and social isolation. It is important to provide patient and encouraging support, and consider using assistive communication resources such as communication boards or text-to-speech apps. Speech and language therapies can also be helpful in helping the individual maintain their communication skills for longer. 7. Lost objects and confused memory. When to worry. Losing objects and being unable to retrace their steps to find them is a common symptom of dementia. Affected individuals may place items in unusual places, such as leaving a cell phone in the refrigerator or a watch in the oven, and then be unable to remember where they placed them. This loss of objects can occur frequently and cause frustration and anxiety. Additionally, the inability to retrace their steps to find these items can be a sign that short-term memory and the ability to follow a sequence of events are compromised. This symptom goes beyond simple distraction and indicates a deeper problem with information processing and working memory. To help manage this symptom, it may be helpful to establish routines and specific places for important items, use labels or colors to differentiate items, and maintain an organized environment. In more severe cases, it may be necessary to use tracking devices to locate frequently lost items. It is important to approach these situations with patience and understanding, avoiding additional frustration for the patient. 8. Impulsive decisions. How dementia affects your judgment. Diminished or lack of judgment is a significant symptom of dementia, affecting the ability to make appropriate decisions in various situations. This can manifest in various ways, such as in imprudent financial decisions, including spending large sums of money on unnecessary items or being susceptible to fraud. Additionally, the person may have difficulty assessing risk in everyday situations, such as crossing the street without looking or wearing inappropriate clothing for the weather. Lack of judgment can also affect personal hygiene, leading to neglect in appearance or health care. These behaviors can be concerning for family members and caregivers, who may notice a drastic change in the individual's behavior and decision-making. This symptom can result in significant consequences for the patient's and others' safety and well-being. To manage this situation, it is important to provide additional supervision and guidance, and consider creating financial and environmental security systems. This may include limiting access to large sums of money and establishing routines and reminders for daily activities. 9. Isolation and social withdrawal. A warning sign of dementia? Withdrawing from work or social activities is a symptom of dementia that can occur as the condition progresses. Individuals may start to withdraw from professional responsibilities or hobbies they once enjoyed due to increasing difficulty keeping up with conversations, remembering details, or performing complex tasks. The fear of failure or judgment may lead to withdrawal from social activities, resulting in isolation and depression. This withdrawal may be gradual, with the person initially avoiding activities that require a lot of concentration, eventually avoiding social contact altogether. Loss of interest in social activities may be a sign of depression, which often accompanies dementia and exacerbates cognitive symptoms. It is important to encourage engagement in social and cognitive activities, which are crucial for maintaining mental and emotional health. Support groups and occupational therapies can help keep the individual engaged and active, providing a sense of purpose and community. Understanding and support from family members and caregivers are essential to helping the patient maintain an active and healthy social life. 10. Unexpected mood changes. When to be concerned. Mood and personality. Changes are common in individuals with dementia and can range from irritability and anxiety to depression and apathy. The person may exhibit sudden mood swings, such as shifting from calm to anger or sadness without apparent reason. Additionally, personality changes may occur, such as a normally extroverted person becoming introverted, or vice versa. These symptoms are often caused by brain changes that affect emotional control and behavior. Frustration with the loss of cognitive abilities and the inability to perform daily activities can contribute to these mood changes. For caregivers and family members, dealing with these changes can be challenging, as they may not recognize or understand the patient's behavior. It is important to approach these changes with patience and empathy, and seek medical guidance for proper symptom management. Behavioral therapies and psychological support can help manage these symptoms and improve the quality of life for both the patient and their caregivers. In some cases, medication may be necessary to help stabilize mood and reduce anxiety or depression. 11. Disorientation in familiar places. Understand what's happening. Disorientation in familiar places is a worrying sign of dementia, where individuals may get lost in familiar environments or forget the location of important places. This can include difficulties finding their way back home, even from nearby places, or getting lost in a familiar setting, such as a store or a friend's house. This disorientation can be particularly dangerous, especially if the person is alone, increasing the risk of getting lost or entering potentially dangerous situations. Additionally, disorientation can cause anxiety and fear for both the individual and family members, who may be concerned about the patient's safety. In extreme cases, additional safety measures, such as using tracking devices or personal identification that can help in case of loss, may be necessary. Maintaining a familiar and predictable environment with established routines and clear signage can help reduce the risk of disorientation. It is important to monitor these symptoms and discuss safety strategies with healthcare professionals to ensure the patient's well-being. 12. Abstract concepts. What dementia does to your understanding. Difficulty understanding abstract concepts is a symptom of dementia that affects the ability to process and interpret information that is not concrete or immediately obvious. This may include problems with numbers, such as calculating change, understanding dates or times, or managing personal finances. Individuals may have difficulties understanding concepts like time, distance, or spatial relationships, which can affect their ability to perform daily tasks. Additionally, understanding abstract concepts in conversations, such as metaphors or jokes, may be impaired, leading to misunderstandings or confusion. This symptom can be particularly frustrating, as it affects the ability to perform activities that were once simple and automatic. Early intervention, with the use of support strategies such as visual reminders, clear and simplified instructions, and tools to help with calculation or task organization, can be helpful. It is important for family members and caregivers to understand these difficulties and adjust their expectations and communications accordingly. 13. Motor coordination. The surprising impact of dementia. Problems with motor coordination are common in advanced stages of dementia and can affect the ability to perform precise movements. This includes difficulties performing tasks requiring hand-eye coordination, such as eating, dressing, or holding small objects. Individuals may become clumsy, frequently dropping objects or having trouble using household utensils, such as cutlery or tools. Dementia can affect the ability to walk safely, increasing the risk of falls. These coordination problems are particularly common in specific forms of dementia, such as Lewy body dementia, which may also include tremors or muscle stiffness. Loss of motor coordination can significantly impact independence and quality of life, requiring environmental adaptations such as installing grab bars, removing obstacles, and using appropriate footwear. Additionally, physical therapy and exercise may be recommended to help maintain mobility and muscle strength. It is essential to monitor these symptoms and adapt the environment to ensure the patient's safety and comfort. 14. Repetitive behavior. A response to mental confusion. Repetitive behavior is a common symptom of dementia where the individual may repeatedly perform actions, ask questions, or repeat phrases constantly and persistently. This may include activities such as repeatedly washing hands, rearranging objects, or asking the same question multiple times in a short period. This behavior can be a response to anxiety, confusion, or a need for structure and familiarity. While repetitive behavior can be frustrating for caregivers and family members, it is important to understand that it may be a way for the person to cope with their altered perception of the environment and memory loss. To manage this symptom, it may be helpful to create a predictable routine and provide engaging activities that occupy the patient's time constructively. Redirecting the individual's attention to a different activity or creating positive distractions can also help reduce the frequency of repetitive behavior. In more extreme cases, where the behavior becomes disruptive or harmful, it may be necessary to consult a healthcare professional for additional management strategies. 15. Sleep and appetite. What radical changes can reveal? Changes in sleep and appetite habits are common in individuals with dementia. This may include insomnia, excessive daytime sleepiness, or fragmented sleep patterns. Some patients may become agitated or confused at night, a phenomenon known as sundown syndrome, which can lead to frequent waking and wandering. Changes in appetite may include loss of interest in food, changes in food preferences, or craving certain types of foods, such as sweets. These symptoms may result from changes in the brain that affect circadian rhythms and appetite control. Managing these symptoms may include establishing a regular sleep routine, avoiding stimulants such as caffeine before bed, and creating a comfortable and safe sleep environment. For appetite issues, offering small, frequent meals with nutrient-dense and easy-to-eat foods may be helpful. Consulting a doctor or nutritionist may be necessary to ensure the patient is receiving adequate nutrition and to develop strategies to improve sleep quality. Finding support. First steps in facing dementia. Seeking help and support is essential when noticing signs of dementia. Consult a doctor for evaluation and early diagnosis, which can improve symptom management. Support groups and community services can offer valuable resources for patients and caregivers. Planning for future care is crucial to ensuring quality of life. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video. See you in the next video. See you in the next video.